creating and completing a note. Let's say you're at a facility, they've wanted to add on a person. You did confirm that their insurance is valid. You want to go ahead and do the note yourself because things weren't happening right. So you want to add a visit to your schedule. You'll click new appointment. If it doesn't show like you can, everything looks blocked, you can click on the side here and click new appointment. Select your patient. Put test. Do test 4. Okay, we've selected the patient. Just ignore this, it always pops up for no reason. Click the visit type, which should be either established patient or new patient, whichever is appropriate. We'll say established patient. Reason, there's a few choices here. Follow up, sick, we'll put. Doesn't matter that much. Okay. Yes, I want to make the appointment. Yes, I want to make it. Okay, and so that appointment exists now. We're going to click right click and then go to view progress notes to go to the note. So this is now a blank note. How do we get it filled in? If it's an existing patient, well, we go to templates first. And right here it says patient specific. And here's their previous visits, and you can choose those as the template. Or if it's a new patient or you have some other issue going on, here are some of the more common templates we'll use, and you should get familiar with how they all look. Just kind of create pretend patients and get used to looking at a few of these. These are the main ones we deal with up front, but you can keep looking and there's tons of all kinds of different things. But we have the most frequent ones up front. So let's say we have a current patient and we want to do a hospital follow-up note. So first we'll grab their previous visit and click merge. Merge means add it onto. No, they didn't have very much then, so let's merge another visit. Okay, so we merged a previous visit and it used all the elements. If you only want to merge a few items, you click it, unclick it, and pick those items that you want to be part of the new note. Okay, so you pretty much populated everything from previous information. Make sure there's no blank historical things. If it's blank family history, you go in there and just say reviewed, non-contributory. So I've considered it and there's nothing that I need to consider. But all your historical information should have at least one item. Now what happens if you do another merge? Well, you've just duplicated your whole note, and look what a big mess it turns into. Everything's duplicated, duplicated, duplicated. Oh, that's a big mess. So we want to undo that. Go back here, and you'll click the little arrow and click copy. Copy means take these elements and overwrite them. Okay. So you just erased all that duplication. Now this person's for a hospital follow-up visit, so we have a template for that. We go to from patient specific up to generic, and we go to hospital, ER, rehab, any discharge needs discharge date. So we'll merge that. We don't copy it because we want to keep all the old information. This is just specific to hospital follow-up. So you go up here and it tells you in the HPI they had a recent transition of care. They're either seen within 7 or 14 business days. Reviewed the medications and reconcile them. You need to have the discharge date and the discharge diagnosis. And you should, if at all possible, get copies of the discharge summary to have on file. That's important also. So, but the main thing is reconcile medicines, get the discharge date, and the discharge primary diagnosis. You do your physical exam changes, your assessment primary diagnosis needs to be the discharge diagnosis, period. You really don't need to put chronic conditions, but you can if you want. Um, and again, make sure mental codes are on the bottom. But the main thing are the hospital codes, and the primary code should be the discharge diagnosis. It should match. Um, as you're completing the note, you'll see it has both 14 and 7-day discharge. So you need to pick which one you need to delete. If it's within 7 business days, it's the 7-day discharge, which reimburses much better. The 14-day is reimbursed differently. But again, remember this is within business days, not pure calendar days. So if somebody was discharged on a Thursday and they're seen on Monday, that's within 2 business days. Okay. These should be deleted because it's a hospital visit, not these other things. So you go through each one of these and remove it. Remove it. So you'll go to that until you're left with the hospital 7-day. And then once you're done with the note, you click done. Now a hospital follow-up visit is held for 30 days, and if the person goes back to the hospital in the next 30 days, the billers have to go back and change this to a regular follow-up, but it can't be predicted. But what this happens is we have to hold on to the billing for 30 days. So this particular visit, you'll get reimbursed for in approximately 6 weeks rather than within 2 or 3 weeks. So that's a hospital follow-up visit. If you need to do another kind of template, there's different kinds of templates.